Well, I think just like the general public, police officers for years have been aware of and seen the dangers with people being distracted while they drive. The number one issue that came to our attention was watching people drive and try and use a cell phone at the same time.
It really boils down to that we think in about 25% of crashes there's some form of distracted driving involvement. So people are getting injured, people are getting killed.
We knew that if we were going to change behavior, we had to do it through education. So we formed some partnerships with other groups. The big ones, of course, were ICBC, the Superintendent's Office, Motor Vehicles. But we found a big ally with the BC Medical Association, where we sought their views on this being, is there some medical background that they saw injuries and fatal accidents and they could link it back to this, which they did.
I've seen patients that have been struck while on a bicycle and had devastating traumatic brain injury as a result of that. So realize how a moment's distraction by that particular truck driver had a very lasting effect on one individual. I also know that the survivors of someone who's killed in an accident have a very difficult time to deal with. And those are the patients that we as physicians see.
I don't think any one organization can manage the whole road safety agenda. And I think if you have a bunch of different partners involved in it, you get a bunch of different ideas, people attacking the problem with different angles, and you gain more credibility if it's more than one organization speaking about whatever the issue is. And so if you have that coordinated effort, I think you get a better outcome from it.
And it was the push through the medical community, the BCMA, the Medical Association. They passed a series of motions clearly against distracted driving, cell phone texting while driving, and others. And once the three of us got together, that's all we needed.
Initially, the requests were turned down by government. We'd asked that they bring in legislation to prevent the use of at least handheld cellular devices, and that drivers that were using them be charged with driving with undue care and attention until there was legislative change. The message we got back was that they couldn't tell the police what to do and that they would take the request under consideration, but nothing further was done for a number of years.
So we work with these other groups to all of a sudden move it to the next level, and it worked out very well. It's one of those few times when we saw a number of groups together work hard together with great results.
This is an important change. It's good to see the attitudes are changing, and I think it's also good as technology advances to pay attention to things like text messaging, which is even more dangerous than use of cell phone.
We've had some cases here, even with the legislation. We've had a conviction in Victoria for a fatal accident where a woman was texting. In her inattentiveness, she struck a motorcyclist. A fellow died a week later in the hospital. So we can actually link distracted driving, the using of texting, using the cell phone to actually people dying as the result. So it's pretty compelling evidence.
Well, we don't know the collision statistics yet. We do know some of the violation statistics, and I understand there were more than 30,000 violation tickets that were issued in the first year since the legislation was passed. And I think what's more important is that there's societal change too, that when someone is now using a cell phone, they're likely to get a lot more disapproval than was the case before. And I think that people are paying more attention to the consequences of it. What happens when people are distracted, that they may not stop in time for an intersection, they may not see a pedestrian or cyclist, they may weave out of their lane, etc.